Thanks for joining us.
Talkline Network Radio, America's longest-running Jewish broadcast network, the voice of the Jewish community.
Welcome to the podcast. You are now tuned in to this episode of our podcast. Today, we are going to interview some of the greatest and most influential minds in our field. And now, please welcome your host.
You're listening to Talkline with Zev Brenner, America's premier Jewish broadcast on the air since 1981.
And we're back. You know, people always talk about hospitals and healthcare that has to be more responsive to people's needs, especially to the community, and the Jewish community, of course, in particular. And we're going to be looking at a hospital EHS, which actually works and caters to the Jewish community. So with us right now is Dr. Jacqueline Marecheau. She's the chairperson, Department of Obstetrics and Gynecology at EHS, Episcopal Health Services. She is responsible and leads the strategic, clinical, and operational direction of the women's health services across the health systems. And she also responsible for enhancing the patient experience, promoting evidence-based practices, advancing maternal health equity, fostering a multidisciplinary team dedicated to comprehensive obstetric and gynecological use. Welcome to the program. Thank you for joining us.
Thank you so much. That was a mouthful.
Yes, you come. I didn't even speak about all the stuff that you've done and accomplished. You've been there since 2020,
yes.
So which is great. But besides the titles, what's important, I think, is patient relations and how you deal with the community, and you want to feel that they're really caring about you, and that's something which is so important as a community hospital. I think that's where you excel very, very well.
Yes. Thank you again for that introduction. I would like to think so. I think being a mom myself really helps with understanding the community, but in a more intimate way. I have one son. I delivered my son in Brooklyn, and so my want for this community is for them to experience the same type of delivery experience that is befitting to all women.
Well, I think what you're referring to, and I know that there's an excitement at Episcopal Health Services about the new labor and delivery suite and what it means for the Rockaway Five Towns surrounding communities.
Yes, absolutely. I think that this unit, for me, it's a love letter to the community. I think after we completed a community health assessment, and the ask was to maintain labor obstetrical services out here, we decided to provide a space that is befitting to the community. It's a space that speaks to me. We listened to what they had to say, and we made it a reality. From all 6 spacious rooms that we have, plus an overflow space, it's nothing short of spectacular.
And there are a lot more babies being born in the area in the last 5 or 10 years. So it's certainly an important community service. Can you tell us that aside from being brand new, what other features, amenities can people expect from the new suite?
We have a number of grants that we have utilized to provide doula services. So we have a doula care program. We have a maternal social determinants of health program. And so all of these programs, even outside of the grants, but it's also sponsored by Episcopal Health Services, helps to provide extended services for our patient population. Although at times it feels like interactions with your provider is so short, our doulas are there to provide that extra support, that tender touch, that ear of support that is beholden to what is required for our most vulnerable population. Our most vulnerable populations are our pregnant moms, right? As a person who has delivered a baby herself, it's a very, very tender time, and it's always nice to have someone to be there for you every step of the way.
Absolutely true. And of course, it's as I mentioned, there's so many new expecting mothers because the area is growing and the religious population has lots of kids. So let's address what support St. John's Episcopal Hospital does for religious observant Jewish families, especially in the case of expectant mothers.
I think we at Episcopal Health Services have gone above and beyond for all faiths. I think, not I think, we have a Sabbath elevator, we have a respite room, and we have partnered with um, Rabbi Bender, we've partnered with Eskiezer to provide those additional support services as well. And we also have, training services for our residents. Our residents are on the front lines most of the time. And so they're well versed in, all walks of life that enter Episcopal Health Services.
But you didn't mention one of the most important things,
What?
which is the beautiful views of the ocean.
Well,
Which
of course,
isn't that
goes
relaxing?
without saying.
But isn't that very therapeutic from a medical point of view? When you look out at the ocean, and don't you feel more relaxed?
Absolutely. I think, looking at the water, looking at the views, all that serenity is helps, your mind, body, and spirit.
Now, let's also focus on maternal care, because it's so important right now that women should be taking care of themselves. And I think people more into this kind of keeping yourself healthier. But why is this investment so important right now, at this particular point in time?
I think women of childbearing age are very, how can I say? It's a very vulnerable time, and it's one of the most happiest times of our lives, that reproductive time. And I think at the end of the day, we all want to go home with a healthy mom and healthy baby. And I think that having this new unit, having the associated support services are vital for our expectant moms.
No, it's important, and they have to take care of themselves, and especially if they have other children. So they have, on one hand, you have to take care of the new baby, and you can have 5, 6, or 7 kids running around the house. So it puts
Right.
extra stress, but they still got to take care of the health.
Correct. Absolutely.
Now, tell us about EHS's doula services.
So our doula program originated in 2021. The executive director came up to me and said, "Oh, is there something that we can do for maternal services?" And I still live in Brooklyn. We had a robust doula program at the hospital that I worked, and I said, "Oh, we don't have that here. Why don't we start something up?" And so we raised money on Giving Tuesday, and I think it was November at that time. And we raised a small amount, and since then we've had several grants, and right now the hospital sponsors the entire program. And every mom or every prospective mom who wants to have a doula are able to. It's free of charge. All they have to say is, "May I have a doula, please?" And we can provide that person on the spot. What a doula is a person that provides emotional, social support, as well as some type of physical support while they're in labor. They're provided during their prenatal visits, during their labor, as well as far as 12 months after the delivery of your child. And so there is that tender touch. There's that person that's there to help you, even if it's with the little things, right? Some light housekeeping, just to talk, or even to provide some type of childcare services. So they're there to just make your postpartum life easier.
So how does it work? Does a patient have to come in? Do they just need telephone contact? Does a doula visit the home? What's the process during the 12 months?
During those 12 months, most of the time it's a virtual conversation, albeit a telehealth or a phone call. And if the patient requests a home visit, that's possible as well.
Now, I understand that St. John's recently earned baby-friendly redesignation. Can you tell us what that means?
Well, it's a huge deal. This year we went through redesignation, and this is my first time going through the entire process with an organization. But there are at least 81, I believe 81 different criteria that needs to be met, and we met all 81. From skin to skin, bonding, family bonding, etc. It's all encompassing, and we are proud that we are a baby-friendly redesignated facility. Not everyone gets to have that title, but having worked through that process myself, I'm really ecstatic that myself, as well as the rest of the nursing team, was able to pull it through.
Wow. So you're probably getting parents coming from all over, not just from the local Queens, Long Island area.
Yeah, absolutely.
And it's a great investment to have a baby-friendly designation. So can you tell us, I think one of the things that people say, well, we have lots of hospitals that involve maternity and delivering babies, but I know you're working very, very hard to be distinct between, of course, the religious accommodations and the labor and delivery suite, which is new, the doula support, which goes for a year, baby-friendly designation. These all make a very big difference in maternal care investment, puts a lot of work and effort for it, but I know it's important because it's not just delivering the baby. There's a lot more, as I just outlined, that go into making patients stay comfortable way beyond even the initial delivery of the baby.
Yes, absolutely. I think this unit provides an experience for our patients that are none other. I think that having an LDRP, which stands for Labor, Delivery, Recovery, and Postpartum, that experience all in one room without having to be shuffled here, there, and everywhere is really an experience that everyone should have. It should be the standard of care for all patients. I think
Absolutely.
That, our spacious rooms, the views, the ambiance, that all lends to that the psyche of medicine, if you will, really lends to what like I mentioned, every patient should experience this.
Well, I think what you're referring to also is personalized medicine. In the past, it was a group medicine, was like one size fits all. But what you're basically saying, especially with the doula services, is that you're looking to do patient accommodation, making it more personal.
Yes, we ask the patient what they want. It's an individualized care plan, that it's not cookie cutter. If a patient wants to have their experience in the showers, and we have our Novi wireless devices to assist with that, then that's great. If they want to be in the bed, then that's great. If they want to have their families with them, that's also a possibility as well. So again, it's still it's an individualized care plan that's not cookie cutter, and that it's listening to what the patient wants. At the end of the day, it's about their personal experience that is most that's what should happen.
So what is the most important thing you want our listeners on radio and our viewers on YouTube to know about the Episcopal Health Services new labor and delivery suite?
I want them to get the same experience that I had when I delivered my son. I want them to come to the unit, read the commitment message that I co-wrote with one of the nurses. It's on the wall as you exit the elevator bank, and I want them to experience the awe that I experienced once I first laid eyes on that masterpiece that's that unit.
Dr. Jacqueline Marecheau, thank you for joining us. She's Chairperson of the Department of Obstetrics and Gynecology, Episcopal Health Services. Thank you for being with us, and congratulations on the new maternal unit.
Thank you so much for having me. I really appreciate it.
Well, thank you.
Thank you for tuning in to
Talkline with Zev Brenner, America's premier Jewish broadcast, the pulse beat of the Jewish community.
For continuous Jewish programs, TalklineNetwork.com, or our 24-hour-a-day listen line at 641-741-0389. For past shows, you can find us on iTunes, Spotify, Amazon, YouTube, Instagram, and all major podcast platforms, or jewishpodcast.org. Thanks for listening to the TalklineNetwork.com.
Follow us on Facebook, Twitter, and Instagram.